We both as executives, came up through the job, experienced a lot of different things, good and bad. And when we're talking about the mental health, obviously we're talking about the bad stuff. A lot of people, when they talk about, mental health and everything else, the main thing that people harp on is the suicide. And suicide is the ultimate, end all be all. They say, it's the permanent solution to a temporary problem, but it's the problems that lead up to that, sort of, kind of, because we'll talk with our special guest in a couple of minutes about, what people going through that may cause them to commit suicide. But the health and wellness section was brought together in 2019 after a large number of suicides. But there's day-to-day stuff that the men and women of the NYPD, both uniform and civilian, go through and deal with that causes different feelings, right? Because people tend to forget that we're human also, and that we have feelings, and we have depression, and we have anxiety, and we are dealing with situations that most people don't deal with on a day-to-day basis. Remember, when people call the police, most of the time we're responding to somebody's worst moment in their life. So we're responding to people's worst moments time after time after time as we go through our career, as well as dealing with our own personal issues, thoughts, problems, whether it be financial, whether it be marital, whether it be with other types of relationships, whether it be, anything, health. So how do you feel, Rob, that as we came up through the job, let's talk about that. As we came up through the job, how do you think the job dealt with mental health with the members?
I don't think that back then the job didn't prepare you as the supervisor to go and help somebody with that type of mental illness, or that even a little bit of the common problems that we see people have every day. So I just don't think they cared about suicide, but like you said, that was the extreme. But things leading up to it and identification of those incidences, there was no real training or pattern of identification.
Yeah, I agree with you. I don't think the job was completely reactionary when we were coming up through the job. Psych services was the only place to go to. And if you did, 99% of the time, you did lose your guns. So I don't know. I consider it being a stigma when there's not factual basis to it. But I think when we were coming up, I don't think it was a stigma. I think it was a reality. I think that when we were coming up through the job, if you had or acknowledged or were identified because of whatever reasons, an incident or whatever, as having mental health issues, suicidal ideations, or even just depression, that the job went to the nth degree and they took you and put you in that quote unquote rubber gun squad, right? Which was very difficult to recover from. So I do think that is what we dealt with coming up. So it was ignored. I think it was ignored. I think you're correct in that people didn't speak up for one another, where I think today that's different. I think a lot more people are willing to step up and help another member. I think more supervisors are quicker today to make referrals, but I think there's a lot more referrals. I think we're going to go through all the resources, or what I found. There's a lot of stuff out there with a couple of quick Google searches. We don't have access to department computers anymore, right? We don't have the department intranet. But most of the stuff on the department intranet is also available through NewYorkCity.gov, right? So you can find a lot of the stuff right online. And we're going to show you a lot of the stuff and a lot of the resources and things for what's going on today.
Can I give you a quick example of how ill prepared the department was? When I was a sergeant in the inspections unit, we had a call out, and an individual who was contemplating suicide. So we removed all his firearms. Now, back then, the department didn't ask if the person had any long guns because they weren't on your 10 card.
Yeah, wow.
And that individual actually ended up committing suicide with a long gun. So it just shows how ill prepared they were, that they didn't even have the foresight to say there may be other guns that individual has, because like I said, rifles, shotguns, they weren't listed on your 10 card, only pistols, things that came through the department. So, I mean, that's how ill prepared they were.
Yeah. And that probably, to be honest with you, that situation that you're talking about exactly is probably one of the things that changed, because now that's one of the standard questions. And it's in every 49 when we modify anybody, right, or suspend anybody, there's a line in there that they stated they have no access to long guns, rifles or long guns. And so that probably, again, reactionary, right?
Yes.
A lot of times people don't have that foresight and they don't think forward. But I think it's changing a lot. I think that we have a lot more resources with the job. There's still a lot of problems. And again, the ones that hit the papers the most are the suicides, right? Wasn't it recently? There's some stats about a lot of stuff this year that's going on.
Yeah, no, and I don't know if you saw it. I think it was last Monday. Retired MOS. I believe he was retired up about 20 years. Ended his own life out on Lido Beach, and the Nassau County Police, they confirmed after they discovered the body. But I mean, it's just sad that you think that after so many years within the department, and then retired for that many years, that somebody takes their life also. And I mean, I know there could be a multitude of reasons that the person thought they should commit suicide, but I mean, there never is really a good reason. There's ways now, even as I think we'll get into it later, or even as a retired members, you can reach out. But it's just it's just sad that it still continues today.
Yeah, most of the resources are available to retired members as well as active members. There's one or two that aren't, and we'll get into that. So let's bring to the stage. Oh, he's already up. Sorry, I had the screen off. And welcome, Dr. Steve, to the show.
Thank you, Ron. Thank you so much. I look a lot better on paper than I do in person after hearing that.
No, that's not true now, because I got to say, I've known you for probably over 20 years. And, everything on there, I've known for 20 years that you've cared about the members of the service, the first responder community as a whole, but particularly the law enforcement. And so the bio is paper. Why don't you tell us a little bit about yourself and what brought you to be interested in helping out in the law enforcement field?
I guess it starts back where I was born. If you're familiar with Brooklyn, I was born on Howard between Pitkin and Sutter, and was not an easy neighborhood to live in. But after a while, Mom and Dad thought it would be a good idea to move to the Vanderveer projects, and that's where I was raised. But when that became a little bit too difficult, the decision was made to move up to Clarkson between Bedford and Rogers. So I was taught from the day I could remember that, there you go, from the day as far back as I could remember, you see a cop, you thank a cop. It's just what you do, and it stuck with me. And throughout my career, I've had opportunities to pursue that passion.
Yeah, and the Vanderveers look a lot better than when I was patrolling them, and when I was running over there to help out the 6-7 when I was in the 7-0.
I think they changed the name now. Also, it's
yeah, yeah. So yeah, no, so that's great. So you always had a respect for the police, and so when you came into your profession, that's an avenue you wanted to go down.
Absolutely.
So that's great. So I know you work closely, not just with the law enforcement community, but with the NYPD. You do a lot of training with the NYPD. I wanted to bring you up because we kept you off screen,
Sure.
but I just want to go over the health and wellness program and what they are. So who are we is the graphic. I may have it numbered wrong, Jack. There you go. But the things that they do. Again, it was formed in 2019, right? Critical incident stress management. You know a lot about that, right? This is when the psychologists go out and they actually speak to members of the service after a critical incident, which could be an MOS-involved shooting. It could be a traumatic scene. I know I've called them out when I had a murder suicide involving children. And the officers responded to that. MOS involved shootings, like I said, suicides, a lot of different things. They go out to the scene, will come out to the hospital, come back to the command, and they talk to everybody. The employee assistance unit, which is peer counselors, both uniform and civilian, they support people. They have the canine therapy dogs that come out to the commands, the peer support program, which I think is huge. I think the peer support program is one of the most important aspects because these are the people that you're working with every day, and they're both uniform and civilian members, and they're out there in the commands, in the units, and so they get to know everybody. And you'll talk more about getting to know people and how that plays such a role in identifying when somebody's in crisis, right? Wellness education. And here's the big thing. We always talk about the suicides, right? That's the main thing because it's the big thing. It's the ultimate crisis, right? But there's so much more, and there's so much more to mental health, right? So wellness education with fitness, nutrition, mindful, resiliences, right? Financial wellness. People have anxiety and depression because they come into financial problems. Retirement wellness. We know that, right, Rob? When you're getting ready to retire, there's so many questions, and there's anxiety involved with when you're getting ready to retire. This has been, the NYPD policing is not just a job. And now I'm going to go off into retirement and I'm going to collect my Social Security, whatever the case. It's a culture. It's a culture. It's a career. It's not just a job. So that's an important thing. And fitness and nutrition support is big. And these are the things, the main topics of health and wellness. So it's not just about suicide. It's about a lot of different things. So we talked about you're the clinical lead for Finest Care with Northwell Health. So why don't you walk us through that program?
Sure. So Finest Care at Northwell, we're going up almost about 2 years now that the program is with Northwell. And it's a very unique program. As far as I'm concerned, it's very unique. Northwell is New York State's largest healthcare system. In fact, as of this morning, the new numbers came out because we just purchased New Van's hospital system. So right now, Northwell has 28 hospitals. They have 104,000 staff, 20,000 of which are physicians, 22,000 of which are RNs, and a little over 1,000 outpatient centers, covering Long Island, New York City, Westchester, Hudson Valley, now Connecticut, New Jersey as well. So we're really able to provide the services, being the largest healthcare system. So what Finest Care does is it operates a call line where a uniformed member of service would call up 24/7, 365, and they would speak to someone who was a behavioral health expert. That person would then triage the call, and the person would be given, the MOS would be given an appointment generally within 48 hours. That appointment would be with a psychologist and or a psychiatrist if medication were an issue. So the resources are there. Our clinicians are doctoral level clinicians, PhD or PsyD. What makes this incredibly unique is that the officer then gets 5 free sessions, no insurance, no co-pays. So there's no tracking of any sort that takes place. And if additional sessions are needed beyond those 5, because it's Northwell and we have the resources, the referral is made to what we consider to be culturally competent clinicians for longer term counseling if that's needed. So it's unique in that way. And earlier you mentioned, some organizations have restrictions. If somebody is jammed up, our belief is that that's when you should call us. That's probably when you need us the most. So there's no restriction on somebody being jammed up, being able to utilize the service, which is very good.
And one thing I think that's important to point out about Finest Care, this is one of the only programs that is only available to active members.
Exactly. It's also the only program that is truly external from the department. If you just do a simple Google search, NYPD mental health resources, it'll bring you to the department page where it lists internal and external resources. And you'll see that Finest Care is the only external resource. In fact, if you ever visit a hospital, you see the nurses or physicians typing on a computer, either at the patient's bedside or outside, and they're entering information into the electronic medical record. Finest Care, the information does not get entered into the Northwell electronic medical record. It's a separate system.
Go ahead, Rob.
Doc,
Yeah.
Doc, is there can like a member of service do a referral for their partner? Is there any way to do that?
No, the person who is in need of the services would be the one to call.
Okay.
But we would work with that person calling to encourage them and explain different ways that they could get that person to reach out.
You've just watched a clip from our live episode. Click the description to watch the full episode. Like, share, and subscribe for more videos just like this.